This virus is an endemic virus, which means it's going to continue to circulate in our species like the seasonal flu does. This virus does not seem to mutate quite as much, so hopefully the vaccine that's developed next year will be effective for longer than a year. But it's going to come back, and when it comes back this winter, we will not have a vaccine for it, so we have to develop strategies to mitigate its impact on us. And that's going to range from all the things we're learning how to do now, social distancing and the like, but also smart strategies about therapies that may work better from people when they first get diagnosed through when they're in the ICU. And we're seeing dramatic advances, but most of them aren't improving because we're fighting the battle as we're trying to figure out what works.
Absolutely. That leads us perfectly to what Scott Gottlieb, the former FDA head, wrote in the Wall Street Journal this weekend, quote, "A vaccine could beat the virus, as you just noted, but there won't be one this year. The best near-term hope, an effective therapeutic drug, that would be transformative, and it's plausible as soon as this summer, but the process will have to move faster." Now, you've been pushing this, as Gottlieb has the idea, we got to get going on this, and there are various trials out there. But as you know, Dr. Fauci and others have said, hold on a second here, we don't have enough data. Where are we in all this now?
Well, I keep hearing this word anecdotal thrown around. And anecdotal data is interesting because it's a gut hunch from someone who's tried something and has an experience. If you're a detective, you collect clues. And the major thing a doctor does is ask questions and then look for solutions. So as I look around, and I'm not alone in this, this is the number one feeling that most physicians have, but it's only a feeling. The ideas out there, some of them make sense. Hydroxychloroquine is an example. But I want to point out that anecdotal is different from the data we're looking at. We have large case series. I just spoke this morning to Didier Raoult, the famous infectious disease specialist in France, who's got 1,000 patients in a row. Now he's treated with a combination of this old malaria drug plus basically Z-Pak. And he's reporting favorable results, but it's not randomized. And then you actually do have randomized data from China where they took two groups, half got the hydroxychloroquine, half didn't get it. And the half that got the medication had a reduction in time they had a fever, reduction in how long they coughed, and reduction in their pneumonia problems. And that actually is one of the reasons I think China has made it part of their protocol. And many countries now have made it part of their protocol. So we don't know the answer, and we will not know in the near future whether that drug or any of the other solutions are going to work definitively for the COVID-19 problem. But you march into war with the army you have. And I think physicians are saying, I need a couple tools that I think are safe. I just spoke to one of the leaders of the rheumatology community. They've been prescribing these drugs for a long time.